Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Listen closely. Premenstrual symptoms are not just mood, not just cramps, and not just something to tolerate. They are a patterned body-brain signal. They arrive in the luteal phase, usually in the days before bleeding begins, and they improve soon after menstruation starts. That timing matters. Why? Because timing tells us this is not random weakness, it is cyclical physiology. It is the nervous system, endocrine system, immune system, sleep rhythm, pain system, and daily stress load all meeting at the same door. Now ask this, if the symptoms are cyclical, should the response also be cyclical? Yes, but do not wait until the worst day to begin. Start earlier. Train the body before the storm arrives. Use aerobic exercise not as punishment, not as weight loss pressure, and not as a vague wellness slogan. Use it as a structured clinical tool. The American College of Obstetricians and Gynecologists states that regular aerobic exercise can lessen PMS symptoms, and its management guideline for premenstrual disorders recognizes exercise and nutritional therapies among evidence-based options within a multimodal plan. This is important because PMS often needs layered care, education, tracking, sleep, nutrition, mental health support, and sometimes medication. Aerobic exercise belongs in that plan because it acts across multiple systems at once. So today, do 3 things. First, understand why aerobic exercise can help. Second, learn how to apply it without making symptoms worse. Third, leave with a practical plan that can be started gently, repeated monthly, and adjusted with intelligence. Begin with the central question: why would walking, cycling, swimming, jogging, or dancing affect premenstrual symptoms? The answer is not as simple as exercise releases feel-good chemicals. That is true, but incomplete. PMS is not only about one hormone being too high or too low. Many people with PMS have normal hormone levels. The deeper issue appears to be sensitivity. The brain and body may respond strongly to normal changes in estrogen, progesterone, and progesterone metabolites such as allopregnanolone. These molecules interact with systems involved in mood, calm, irritability, pain, sleep, appetite, and stress response. Reviews describe serotonin and GABA-related pathways as key pieces of this puzzle. Pause there. Ask yourself, how can the same menstrual cycle be barely noticeable for one person and deeply disruptive for another? The answer may be in the volume knob, not just the signal. The hormonal signal happens in both people, but one nervous system may amplify it. That is why the goal is not to erase the cycle. Do not fight your biology. Train the volume knob. How does aerobic exercise help turn that volume down? It improves communication between the brain and the body. Aerobic movement influences serotonin, dopamine, endorphins, endocannabinoids, brain-derived neurotrophic factor, inflammatory signaling, and the stress response system. These are not abstract laboratory words, they translate into real experiences. Less irritability, less tension, better sleep pressure at night, lower pain sensitivity, and a stronger sense of control during a phase that can otherwise feel hijacked. Now look at the evidence. A 2020 systematic review and meta-analysis in BJGP Open examined randomized controlled trials of exercise interventions lasting at least 8 weeks in women with PMS. Across 15 trials with 717 participants, exercise was associated with reductions in global PMS symptoms. In the trials included in the primary meta-analysis, the standardized mean difference for global symptoms favored exercise. The same review reported improvements in psychological, physical, and behavioral symptom groupings, while also warning that many trials had quality limitations and that results should be interpreted with care. That balanced message is exactly what we need. Exercise is promising, useful, and low cost, but it is not magic and should not be oversold. Another systematic review focused specifically on aerobic exercise and randomized trials. It concluded that aerobic exercise improved physical and psychological premenstrual symptoms. Think about that for a moment. The intervention was not exotic. It included forms of movement people already understand: brisk walking, running, swimming, cycling, and similar activities. The power is not in complexity. The power is in repetition, timing, and dose. A later review of exercise interventions in women with PMS reported significant reductions in negative affect after exercise. Why does that matter? Because many people fear the emotional symptoms more than the physical ones. Bloating is uncomfortable, breast tenderness is distracting, cramps are painful. But sudden anger, sadness, anxiety, or a feeling of being unlike oneself can damage confidence, work, relationships, and self-trust. If aerobic exercise can reduce negative affect, even partially, it gives the person back a margin of choice. Now ask, how should we use aerobic exercise for PMS in real life? Do not begin with heroic intensity. Begin with consistency. Choose an activity that raises the heart rate and breathing but still allows short conversation. Use the talk test. If you can speak in phrases but not sing comfortably, you are probably in a moderate zone. Brisk walking counts, stationary cycling counts, swimming counts, low-impact dance counts, elliptical training counts, marching indoors counts. If the body is already tender, choose lower impact. If joints hurt, use water or a bike. If fatigue is strong, begin with 10 minutes. Why not start hard? Because the luteal phase can already bring sleep changes, heat intolerance, cravings, lower stress tolerance, and heaviness. For some, intense exercise during the worst days can feel like adding noise to an overloaded system, so be strategic. Build the base in the follicular phase after bleeding begins and energy often improves. Then maintain gentle to moderate movement in the premenstrual days. Do not ask the body for a performance peak when it is asking for regulation. Here is the practical prescription. Aim for at least 150 minutes per week of moderate intensity aerobic activity, such as 30 minutes on 5 days, matching general adult activity guidance. If that feels too large, split it. 10 minutes in the morning, 10 minutes at lunch, 10 minutes in the evening. The body does not require drama, it responds to repeated signals. Add 2 days of strengthening if possible for general health, but keep aerobic work as the central tool for PMS symptom control. Now build a cycle plan. For days 1 to 7, if bleeding and pain allow, walk gently or do easy cycling. Do not use pain as a scoreboard. For days 8 to 14, gradually increase pace or duration. This is a strong time to build fitness for many people. For days 15 to 21, maintain the routine and protect sleep. For the final premenstrual week, reduce friction. Put shoes by the door, choose familiar routes, use music, walk with someone, or schedule indoor movement if weather becomes an excuse. Ask, how do we know if it is working? Track it. Do not rely on memory, because PMS can distort memory from both directions. On good days, you may minimize the pattern. On bad days, you may feel it has always been this bad. Use a simple daily score for mood, irritability, bloating, pain, cravings, sleep, and energy. ACOG recommends recording symptoms daily for at least 2 to 3 months to help identify the pattern. That tracking is not busy work. It is how you separate PMS from thyroid disease, depression, anxiety disorders, anemia, medication effects, endometriosis, and other conditions that can imitate or worsen cyclical symptoms. Now consider the why behind physical symptoms. Bloating, breast tenderness, headache, muscle aches, and pelvic discomfort are not disconnected from the brain. Pain sensitivity changes with sleep, stress hormones, inflammation, and attention. Aerobic exercise can lower pain sensitivity through descending pain control pathways, improve circulation, and support anti-inflammatory signaling. In menstrual pain literature, exercise is also discussed in relation to prostaglandins and inflammatory mediators, which helps explain why movement may affect cramping and body aches beyond mood alone. But give this command clearly: respect red flags. If symptoms are severe enough to cause major relationship conflict, missed work, self-harm thoughts, panic, or loss of functioning, do not treat exercise as the only answer. Seek medical care. PMDD, the more severe premenstrual mood disorder, may require targeted treatments such as SSRIs, hormonal approaches, cognitive behavioral therapy, or other clinician-guided care. Exercise can support treatment, but it should not become a reason to delay help. How do we keep the plan doable? Attach it to existing life. Walk immediately after brushing your teeth. Cycle while watching one episode. Swim on the same 2 evenings every week. Take a brisk 12-minute walk after lunch. Put movement on the calendar before the premenstrual week begins. Do not negotiate with symptoms when they are loud. Decide before they arrive. Use the minimum dose rescue rule. On the worst day, the goal is not 45 minutes. The goal is to keep the identity alive. 5 minutes of walking, 5 minutes of stairs, 5 minutes of gentle cycling. Why? Because breaking the chain often creates guilt, and guilt feeds avoidance. A 5-minute session says, "I am still caring for myself." That message matters biologically and psychologically. Also, choose the right intensity for the right symptom. If irritability is high, use rhythmic movement, walking, cycling, swimming. If sadness is high, use daylight and outdoor walking when possible. If anxiety is high, avoid maximal sprints, choose steady breathing and a predictable route. If bloating is high, use low-impact movement and hydration. If fatigue is high, start with 10 minutes and reassess. Say this to yourself: begin first, decide later. Many people discover that motivation arrives after the first few minutes, not before. And do not ignore the social layer. Walk with a sister, friend, partner, neighbor, or group. PMS can isolate people. Movement with another person can reduce that isolation without requiring a long emotional explanation. Sometimes the walk becomes the conversation. Sometimes the silence is enough. So what is the central message? Aerobic exercise helps PMS because it does not target only one symptom. It touches mood regulation, pain control, inflammation, sleep, stress physiology, circulation, and self-agency. It gives the body a repeated signal of stability before the premenstrual phase begins. It is simple, but not shallow. It is accessible, but physiologically deep. Do not wait for the perfect month. Start with 10 minutes. Track the pattern. Build toward 150 minutes per week. Adjust intensity before symptoms peak. Ask every cycle, why did this week feel better? How did sleep, stress, food, and movement interact? What should I repeat next month? Treat the cycle as data, not as defeat. And remember, PMS is not a character flaw. It is a body-brain pattern, and patterns can be influenced. Move with patience. Move with strategy. Move as an act of medical self-respect. Take care of yourself and take care of each other. We are learning this together like a family that wants everyone well. See you in the next topic.